We're now joined by our longtime friend, Mike Maron, President and CEO of Holy Name Medical Center, to fully disclose one of our longtime underwriters. Hey, Mike, first of all, welcome.
Thank you, Steve. Glad to be here.
What is the new Neuroendovascular Institute at Holy Name, and why is it so significant, particularly as it deals with issues of people dealing with strokes?
So the Neurovascular Institute is critical. In Bergen County alone, on any given week, there are 400 ambulance calls that go out for stroke-related symptoms. Now, not every one of those turns into a stroke, but you don't know until you're fully diagnosed in an ER and know what's going on. And we know in stroke care, time is precious. The faster you get diagnosed, the faster you get the therapeutic interventions, no matter what they are, the more important, the better the recovery, the better the outcome. So time is the most important factor. Everybody's working against the clock. Holy Name has one of the more efficient ERs. You can get in and out of our ER very fast. And we're enhancing that with a digital platform that's going to make it even faster and better. So in the field triage seamlessly transmitted into the emergency room. Orders are being placed before you even get here. Diagnostics are happening before you even get here.
Oh, Mike, hold on, back up. You're talking about EMS professionals.
Correct.
911's called, they come.
Right.
What the heck does that have to do with technology, a potential stroke, and then being treated at the hospital? Connect that for us.
All right. So today, unfortunately, everything in healthcare across all platforms is fragmented. EMS works in a set of software and tools that are designed purely for the paramedics in the field. They're not designed to connect the paramedics in the field to the emergency room and then the emergency room to the inpatient setting. So it's all broken down communications. If time is the most imperative factor, then seamless, accurate communication, non-repetitive communication is the most important factor to get someone into the proper therapeutics, make faster, accurate diagnostics, and get them into the appropriate therapeutics. So that communication link doesn't work very efficiently today at all. And so we're building a platform to enhance that.
Okay, so let's switch gears. We've been doing programming around the physician shortage. Obviously, check out our previous interviews with some of Mike's colleagues on the nursing side. We just did one with one of your colleagues talking about the nursing shortage. We could stay on the physician shortage. Connected to graduate medical education, particularly the new residency program in OBGYN, obstetrics and gynecology, the residency program. What does that have to do with the physician shortage in the OB universe?
So part of it is it's a combination of factors. You have to produce more physicians, first and foremost, to overcome the shortage that is here and only going to exacerbate over the next decade. There's no doubt about it. There's no dispute about this. The shortage of physicians over the next 10 years is going to become more acute than it is even today. So one, solve that problem, train more doctors, get more people interested in the field. So you have to have more training programs to get them through. But the second part is, especially for New Jersey, how do I keep them in New Jersey? New Jersey has an incredible breadth of training programs from South Jersey to North Jersey that have been around for years. Unfortunately, we do a very, very poor job of retaining those recently trained.
Why is that, Mike? Why are we losing so many docs?
There's a whole host of reasons. A lot of it has to do with New Jersey itself, cost of living. They're coming out with incredible debt. And if I can go somewhere south or Midwest and make the same money and have a much lower cost of living, I'm going to do that. Part of it is the absence of creative innovation. So if you want to enhance and capture that young population, it's not always just about the economics. It's about fulfilling a purpose and tap into that character of why'd you become a doctor in the first place? You want to help heal your fellow man. How do you do that? How do you reinforce that? Does the work environment acknowledge, reward, and celebrate when you perform in that fashion. That all becomes part of training. So why Holy Name wanted to really get into training, one, create our own pipeline, but two, because of the culture here, which is becoming less and less frequent out in the world, we want these physicians understanding, yeah, you can become a doctor and make a good income. You can also become a doctor and have an incredibly powerful impact on your fellow man from a humanistic standpoint.
Mike, do the other side, the nursing piece. We've done a lot of programming around the nursing shortage. There's a program with your folks together with our higher ed partners at Rowan University.
Correct.
What is that?
So we are now a teaching affiliate of Rowan for both graduate medical education and for our nursing school. So we've synchronized the curriculum at Holy Name with Rowan. So a high school graduate who's not sure what they want to do, want to get into the healthcare industry, could enroll, and you have to pass the entrance exams and you have to meet all the requirements, but you can enroll in Holy Name's School of Nursing, 100-year-old program, has incredible outcomes, produces incredible nurses. And then, so now you graduate in 2 years, you pass your nursing licensing exam, you are now a licensed nurse, you can start working, very lucrative job, very flexible, and continue on with Rowan for another 2 years to get your BSN.
Are there more and more partnerships, or should there be? Because I know your Neuroendovascular Institute is tied to Columbia.
Correct.
Columbia University. Do you see hospital systems and higher education collaborating more and more, Mike?
I think they have to. I think because you need that higher education, you need that caliber of training. The sophistication of healthcare is only intensified, and that's not going to diminish. It's going to get worse. And so to have partnership of that pipeline to keep not just new, but to keep all the people here that are active in treating current, right? So when you take an academic and an educational mindset to what you do day in and day out, that makes the non-student practitioners, whether it's a nurse or a physician or a technician, better at what they do, because they have to think a little deeper because some student is watching them training. And so it makes everybody sharper, more proficient at what they're doing. It's an all around benefit for everybody.
Mike, before I let you go, give me 1 minute real quick. AI and healthcare.
Major, big impact, moving very, very quickly. A lot of good can come out of this, but equally a lot of bad. And so I am concerned at the pace that it's moving. I am concerned that the majority of the industry does not understand AI and what it really means, how it operates, how it learns, what it can do. AI, in the AI world, is a term that's very common. Anybody who goes on to the public domains of a ChatGPT or a Claude will all have, and if you've read any of the literature, there's a term called hallucinating. So AI will falsify and fill in gaps of knowledge to make itself look intelligent unless you strictly train it not to. It also learns off of, with large language models, need accurate databases to learn from. Our data structure, especially in healthcare, is anything but clean and accurate. It's a mess because of how it's evolved over the last 40 years. And so AI penetrating undisciplined data is going to give you undisciplined AI. That's a bad outcome.
Mike, we'll continue the conversation about AI and a whole range of other healthcare-related topics. Hey, Mike, thank you for joining us as always. We appreciate it.
Thank you, Steve. Appreciate it. Honored to be here.
You got to stay with us. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by United Airlines, Kane University, the Port Authority of New York and New Jersey, Valley Bank, South Jersey Industries, EJI Excellence in Medicine Awards, a New Jersey Health Foundation program, New Jersey Sharing Network, the New Jersey Education Association, and by Operating Engineers, Local 825. Promotional support provided by ROINJ and by the Chamber of Commerce, Southern New Jersey.
The EJI Excellence in Medicine Awards was established in 1939, shining a light on New Jersey's healthcare leaders. Current awards include Excellence in Medicine, Research, Medical Education, and Community Service. EJI also funds annual scholarships to medical, dental, pharmaceutical, and physician assistant students throughout the state. Learn more at ejiawards.org.